Vitamin D, also known as D3-2000, is a fat-soluble vitamin that helps your body absorb calcium and phosphorus, which are essential for building and maintaining strong bones. It is used to treat and prevent bone disorders such as rickets and osteomalacia. Vitamin D is produced by the body when the skin is exposed to sunlight, but factors like sunscreen use, limited sun exposure, and dark skin may prevent getting enough vitamin D from the sun. Vitamin D with calcium is also used to treat or prevent bone loss, known as osteoporosis, and is used in combination with other medications to treat low levels of calcium or phosphate caused by certain disorders. It may also be used in kidney disease to maintain normal calcium levels and support normal bone growth. For breastfed infants, vitamin D drops or other supplements are given, as breast milk usually has low levels of vitamin D. The recommended daily dosage of D3-2000 varies depending on age, gender, and specific health conditions. It is best to consult with a healthcare professional to determine the appropriate dosage for you. As for the optimal timing, vitamin D can be taken at any time of day, with or without food, but it is important to take it consistently to achieve the best results. When taking D3-2000, it's best to take it by mouth as directed. You can take it with or without food, but it's usually better absorbed when taken after a meal. If you're prescribed the liquid form, be sure to measure the dose carefully with a special measuring device/spoon. Don't use a household spoon, as you may not get the correct dose. For chewable tablets or wafers, make sure to chew thoroughly before swallowing. And if you're using the rapidly dissolving tablets, you can place each dose on your tongue and let it dissolve completely before swallowing. You don't need to take it with water. It's important to take this medication regularly, at the same time each day, to get the most benefit from it. If you're taking it only once a week, remember to take it on the same day each week. And if your doctor has recommended a special diet, such as one high in calcium, be sure to follow it to get the most benefit from the medication and to prevent serious side effects. Certain medications like bile acid sequestrants, mineral oil, orlistat can decrease the absorption of vitamin D, so try to take your doses of these medications as far as possible from your doses of vitamin D, at least 2 hours apart if possible. It may be easiest to take vitamin D at bedtime if you are also taking these other medications. If you think you may have a serious medical problem, be sure to get medical help right away. When taking D3-2000, it's important to be aware of any unusual side effects and contact your doctor or pharmacist right away. Your doctor has prescribed this medication because the benefits outweigh the risks for you. Most people using D3-2000 do not experience serious side effects, but it's important to be aware of potential signs of high vitamin D or calcium levels. These can include nausea, vomiting, constipation, loss of appetite, increased thirst, increased urination, and changes in mental or mood. In rare cases, a serious allergic reaction may occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, it's best to consult your doctor or pharmacist. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. They will advise you on the appropriate amount to take and the best time of day to take it. If you have any concerns or questions, don't hesitate to reach out to your healthcare provider for guidance. Before starting D3-2000, it's important to talk to your doctor or pharmacist if you have any allergies, especially to vitamin D products or inactive ingredients like peanut or soy. Also, make sure to discuss your medical history, including high calcium/vitamin D levels, difficulty absorbing nutrition, kidney disease, or liver disease. If you're using liquid, chewable, or dissolving tablets, they may contain sugar, aspartame, or alcohol, so it's important to check with your doctor if you have diabetes, liver disease, or phenylketonuria. And don't forget to inform your doctor or dentist about all the products you use, including prescription drugs and herbal products if you're planning to have surgery. For pregnant women, it's important to only use doses of vitamin D greater than the recommended dietary allowance when clearly needed, so make sure to discuss the risks and benefits with your doctor. And if you're breastfeeding, be sure to consult your doctor before using D3-2000. Remember, always talk to your healthcare provider before starting any new medication. When taking D3-2000, it's important to be aware of potential drug interactions. This means that it could affect how other medications work, or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with D3-2000 include burosumab and phosphate binders. Additionally, it's important to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, as they may contain calcium, magnesium, phosphate, or vitamin D. It's best to ask your pharmacist about using these products safely. It's also important to note that vitamin D is very similar to calcitriol, so it's not recommended to use medications containing calcitriol while taking vitamin D3-2000. Lastly, vitamin D may interfere with certain lab tests, such as cholesterol tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are taking this vitamin. As for the daily dosage and optimal timing, it's best to follow your doctor's recommendations. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and irregular heartbeat. As for the uses of D3-2000, it is a vitamin supplement used to treat or prevent vitamin D deficiency. It helps the body absorb calcium and phosphorus, which are essential for maintaining healthy bones and teeth. The daily dosage of D3-2000 varies depending on individual needs and should be determined by a healthcare professional. It is best to take this medication at the same time each day, with or without food, to ensure consistent levels in the bloodstream. Remember to have regular lab and medical tests to monitor your calcium, magnesium, and phosphorus levels while you're taking D3-2000. Make sure to keep all your medical and lab appointments and consult your doctor for more details. You can also get vitamin D from foods like fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. But if you're not getting enough from your diet, your doctor may recommend taking D3-2000 to help support your overall health. It's important to follow your doctor's instructions for the best results. As for the daily dosage, it's important to take the correct amount of D3-2000 as recommended by your doctor. And the optimal timing for taking this medication may vary based on your individual needs, so it's best to consult with your doctor to find the best time for you. If you forget to take a dose of D3-2000, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing vitamin D products, it's important to keep them at room temperature, away from light and moisture. However, if you have alpha-calcidol drops, you should store them in the refrigerator, but be sure not to freeze them. And as with all medications, it's important to keep them out of reach of children and pets. When it comes to getting rid of expired or unused vitamin D products, it's important to dispose of them properly. Instead of flushing them down the toilet or pouring them into a drain, it's best to consult your pharmacist or local waste disposal company for guidance on the proper way to discard them. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.